guys, welcome back to Medical Coding with Blue. I'm going to start this video off a little different. I just want you guys to know that watching my channel, this channel is devoted to the field of medical coding. And I truly do love this field. There are many things about it that I enjoy and I like sharing my knowledge. I think that this field is full of a lot of different personalities, and I feel like there's a lot of people that can be taken advantage of simply because they don't know. And a lot of the reason that I created this channel was to help people to share the things that I know, and hopefully it will help you. I currently hold two certifications. I hold the Certified Coding Specialist Physician Base, and I hold the Certified Coding Specialist credential from the American Health Information Management Association. I held the Certified Coding Associate for 13 years. And I did this because I wanted people to know what a CCA could do, because there's a lot of unsavory talk about the CCA, and I wanted to prove people wrong, and I did. And so I am doing things now to move up in the field, and with this I had to put my CCA to bed, so I went on and got the CCSP and the CCS last year. I have shared many times what I have studied with, okay, and what my recommendations are. I got a comment which inspired today's episode, and this is going to be the first time I'm going to explain myself and the last time I'm going to explain myself about the book that I am recommending to study for the outpatient side if you are wanting to take the CCS exam, right? Now, this book goes for any medical coding certification, either the CCS, the CCA, the CCSP, or even the CPC. These are the four that are mainly asked for, you know, in the workforce. And then of course there are other specialty ones like the CDIP, the CCSDO, and that kind of thing, so on and so forth, when you start getting into specialty things. All right, there are very few other specialty credentials that I recommend, and only because I see a lot of redundancy in a lot of these credentials that are out there, and it's unnecessary because employers don't ask for those other ones quite as often that I have seen. Of course, there may be somebody who comments on here, oh yes, I see that in mine, and that's fine. It's whatever, guys. But what I'm telling you is what you should know as a medical coder. And the things that I share is so hopefully that you will be able to study more and to be able to better understand the field, right? Because it's a lot. We have to know what doctors know while never having gone to medical school. That is one of the things I have said since I started this channel. Because it's true. We have to read this complex documentation. But getting back to why I'm doing today's episode. I got this comment, and after this, I'm letting y'all know now that I am not going to deal with a lot of foolishness in the comments. I'm not. I'm going to start blocking people because of the simple fact that I think as the channel grows and more people say, well, no, I did this and no, I did that. Okay, it's fine, guys. If you do other things, if you find other methods to study with, that's great. But what I'm not going to do is try to sit there and defend what I'm suggesting against somebody that I don't even know. I wasn't even in this conversation. And the viewer brought it back to me and said, well, my friend said this. Okay, so again, there's a lot of people who think they know and they don't know. All right. So that is something that I need you guys to understand. I've been through a lot, and I've seen a lot, and I know a lot when it comes to this field. And so that's why I want to share this with you. But again, I'm not going to sit here and defend myself against somebody that I don't know, and clearly who does not know what they're talking about either. So I'm going to read the comment, and then we're going to get into, you know, the book. So she says, hi, Blue. I bought that AAPC CPC study guide, which is the book I'm going to talk about, for studying the outpatient side of the CCS, because the CCS, if you don't know, it is a mastery of the inpatient side and the outpatient side of medical coding. This is the gold standard of medical coding credentials because it says you have mastered the inpatient coding and the outpatient coding. Two completely different thought processes, two completely different mindsets, and just different books that you got to use, different payment classifications, all of that. This says that you have mastered this, okay? So I have recommended using this particular book that I'm going to talk about because it helped me. All right, it helped me when I was studying last year for the CCS exam. Okay, so she goes on to say, I also see that there is a COC, or Certified Outpatient Coder, study guide, and someone that also has their CCS said I shouldn't use the CPC study guide for the outpatient side of the CCS because it will confuse me since it deals with profi coding. She gave me an example of modifier 26 and said it can't be used for the CCS. She said that I can use the COC study guide since it's not profi coding. Honestly, now I'm confused. So here's the thing, guys. I shared last year when I passed the CCS, everybody was asking me, Blue, what books did you use? And I said that I use the CPC study guide to study for the CCS. Now, I have had, at the time, I had 13 years of experience in the outpatient setting. So yes, I had more than your average bear already known about the outpatient setting. I use this, obviously, to kind of like give myself a little bit more study time. Obviously, my main thing was trying to understand inpatient coding, which is why I relied on the AHA, the American Hospital Association, ICD-10-CM, and ICD-10-PCS coding handbook with the answers, which I will show you here in a minute. But I recommend using this book because it has CPT scenarios in it. It breaks down everything. And yes, while this is a CPC study guide meant for the CPC exam from another coding association, it still uses the CPT book. The CPT book, which is part of what you are being tested on with the CCS. So I said I am going to use this book. This was the book that I used. This one in particular is 2019. Now you can get a 2020, you can get a 2021. That is totally fine. And they have the updated answers. This one has the same exact questions. They're in just different order, right? But they have the same exact questions and just updated answers. So if you get the older book, 2019, and you see that the answers have changed, or they're not the same as what you have in your book, and maybe the answer that you see in the answer key is not the answer that you have in your book at all because the code has been updated, then you know the code has been updated. You can see it's equivalent. So again, I use this because this is what I used. This is what I recommend. I do not know any other ones except for this one. Now, the COC is literally, it is so closely related to the CPC. And yeah, there's maybe a little bit of difference, but again, it's still using the CPT manual. So the whole idea is to get you guys to practice the CPT manual, right? And so in here, they have a lot of vocabulary, they have all your medical terminology, they have all of these things, and I like their questions, I like their rationale, I like the way they break it down. And yes, I have said that although that this is not a AHIMA, CCS, a test prep book, I do not recommend the AHIMA test prep books for any of the certification exams because I have been through them several times. I don't like the way that they're set up. I don't like their rationale. I don't like the way that they have the questions. So I look for other alternatives. Yes, I have said in my videos before that I have unconventional ways of studying, but when you follow it, you know, it's different. It is a different way of learning and you learn from different perspectives, and it's supposed to be meant to be helpful to you, not meant to confuse you. And honestly, if this person is easily confused by what this person's saying versus what I'm saying, you are not ready to take this test. Again, the CCS is the mastery of the inpatient and outpatient coding. And we can go over what this CCS is. So again, every test with the CCS is different. Every test is different. And so it's about understanding medical coding more than it is trying to memorize and learn all of these things. So for the person who told her, well, you can't use modifier 26 and you can't, okay, again, what are you talking about? Because clearly you don't understand what this test is about, or even the fact that not all tests are the same when it comes to the CCS exam. I have always said there's a pool of about 1 million questions because no one has the same exam. Obviously, I'm probably being facetious on the million questions part, but with AHIMA, they do that. Not every test is the same. They're all electronic tests, so that way it's different things that are being tested. But listen to what it says on the website. Here, it says, coding specialists are skilled in classifying data, medical data from patient records, often in a hospital setting, but also in a variety of other healthcare settings. The CCS credential demonstrates a practitioner's tested skills in data quality and accuracy, as well as a mastery of coding proficiency. The CCS certification is a natural progression for professionals experienced in coding inpatient and outpatient records. Coding specialists create coded data used in hospitals and medical providers to obtain reimbursement from insurance companies and government programs such as Medicare, Medicaid. Researchers and public health officials also use this data to monitor patterns and explore new inventions. And it says CCS's review patient records and assign numeric codes for each diagnosis and procedure, possess expertise in ICD-10-CM, ICD-10-PCS, and CPT coding systems, are versed in medical terminology, disease processes, and other concepts. And then it talks about like the eligibility requirements. And then it says that it's a 4-hour exam, but these are the domains. And I've said this many times, if you don't believe the things that I say as far as like what materials to use to study, it is entirely up to you guys. Guys, it really is. But here it says the coding knowledge and skills is 51.9%. The tasks apply diagnosis and procedure codes based on the provider's documentation in the health record. Determine principal and primary diagnosis and procedure, apply coding conventions, guidelines, and regulatory guidance, apply CPT and HCPCS modifiers to outpatient procedures. Again, this book covers the CPT and, coding through there. And going through these exercises in this book is meant to get you practice in the CPT book so that you can be familiar with looking up codes. And a lot of times people who have been coders for years and they kind of get complacent and they think they know, again, it's that unconscious incompetence because you think you know and actually you don't. And they get rusty with, oh, they're really strong in PCS, but they're not really strong in CPT. This is a great refresher. This is a good way of getting back into the groove of looking and trying to think and reason out. Again, it literally says there that you are, one of the tasks in this domain is apply CPT and HCPCS modifiers to outpatient procedures. Sequence diagnoses and procedures, apply present on admission guidelines, address coding edits, assigned reimbursement classifications, and then abstract patient pertinent data from the health record, and recognize major condition and comorbidity MCC, and the condition and comorbidity CC. And then coding documentation is 10.1%, so not really that big a deal, but still review health record and assign diagnoses and procedures, codes for an encounter, review and address health record discrepancies, and then provider queries, determine if a provider query is compliant, analyze the current documentation to identify query opportunities. Regulatory compliance is the other heavy hitter, 29.1% of this exam. And it says ensure integrity of health records, apply payer-specific guidelines, recognize patient safety indicators and hospital-acquired conditions based on documentation, ensure compliance with HIPAA guidelines, ensure adherence to AHIMA standards of ethical coding, and then apply the Uniform Health Discharge Data Set, the UHDDS. So again, when I'm recommending to you guys the books that I use and the books that I recommend all the time, which is this book for studying the CPT book on the outpatient side. Again, there's a lot of different things that you can do to be able to help you to study. But this other one, the AHA, the American Hospital Association, they have their ICD-10-CM and ICD-10-PCS book, coding handbook with the answers. And now this covers all your inpatient stuff. There's also ER scenarios in here. So I recommend these two books over studying with the AHIMA CCS exam prep book, because I'm the one who gets those complaints from people. Well, Blue, I studied with the AHIMA CCS book and I did so good on the practice, but when I took my exam, I failed. Okay, again, those questions are not meant to be in the exam. It is meant to give you that practice and that like the run through of how it feels. But again, those questions are not going to be on that exam. I don't know why I keep having to say that, but I guess I do. So again, this is why I don't take that normal approach to learning. And I was able to pass these 2 exams on the first try. So if that gives you any kind of indication, this is what I did. Now, again, I'm not going to sit here and argue with people about, well, my friend said this and they said that and they want to do this and I'm questioning you. No, we're not going to sit here and question and play games, because I'm giving you guys my information for free. There is no charge for this. All you have to do is watch the videos and just listen. And that's it. And for some people, I know that they get upset with me because there's a commercial on my video. Some knucklehead tried to embarrass me on another YouTuber's LinkedIn page by making this big, huge scene about how I have so many commercials. Well, that YouTuber put her in her spot. So, I mean, guys, YouTube is free. If you don't like the commercials, then use that YouTube Red or whatever they call it for the one where you don't get commercials. You can always do that. Again, I am trying to be helpful. And never have I seen so many people just... there's no other way to say it other than ungrateful. There's no other way to say it. I know there's a lot of people that are grateful and a lot of people that are so thankful that I'm being helpful and everything. But there are so many lately that are just giving me a hard time and saying, well, you know, my friend said this and my friend said that. Where was your friend before? Where was your friend before? Now all of a sudden when you're getting advice and you're hopefully studying like you should, now all of a sudden people are coming out of the woodwork with all kinds of advice. Oh, okay. So instead of asking, and this is another thing too I want to say before I wrap this up, when you're asking a bunch of different people, like, what should I do? What should I do? What should I do? You're going to get a bunch of different answers. And you're going to get a bunch of different ideas on what you should and shouldn't do. Now, whoever you choose to listen to is entirely up to you. That is your business. But at the end of the day, I can only tell you that, again, I took 2 certifications and passed. I have trained many people. I spend a lot of my time studying. I have had this YouTube channel since 2018. Since 2018. And I have nearly 18,000 subscribers now. Organically grown. I don't have to pay for my videos to be bumped up in the rankings. They're done like that on their own. So again, if you want to listen to my advice, great. If you're going to sit here and question and what should I do, you're getting blocked. Plain and simple, guys. I can't anymore. I literally can't. Because again, I'm trying to help you. And for those that are here and that are wanting to learn and grateful to learn, thank you. Thank you for being here. Thank you for your support. I truly do appreciate it. But again, look at the website. If you don't believe me, if you want to insist on studying with only the AHIMA prep book, then by all means, you do whatever it is that you're going to do. Okay? But again, I'm just here trying to help. And that's all I got. So thank you for watching. If this video helped you in some way, somehow, please share it. Like this video if you liked it. And I will see y'all on the next episode. Bye.